All right, here's something that really sounds pretty incredible. It's like something out of a sci-fi novel. A tiny computer chip containing all of your medical information. You have it implanted under your skin, sort of on the back of your arm. There it is. You can't really see it, but you can see the effect it has. Kind of cool, but some say it could also save lives. Others, though, not so convinced about these good intentions and maybe worried. Find out what it's all about next.
Today, a soldier sees a snapshot of the terrain, a pilot an image of the airspace. The
scanner copier.
Doctors and hospitals.
Right price.
Welcome back. I want to turn now to a controversial subject that raises a lot of privacy concerns for many of you about you and your medical information. Now let's backtrack for a sec here. We told you recently about the Cincinnati security company that's implanting chips in the arms of some of its employees. It's basically going to take the place of a security badge. Well, now the company is aggressively marketing the device to doctors and hospitals. You could have one implanted in your arm, the size of a grain of rice, and it would hold your medical information in case of emergency. Some say it might save lives. Privacy advocates, on the other hand, say it raises a lot of red flags, like who would have access to this information, and are they vulnerable to hackers? Let's get some answers here. Let's go to Glenn McGee, a bioethicist from Albany Medical College. Good to have you back on the show, Glenn. And first off with this, is this inevitable? Is this a road we're going down? We're not turning back?
Absolutely. It's just part of the miniaturization of everything. If you carry a cell phone around, you're already carrying identifying information that can be looked up from hundreds of yards away. There's lots of ways in which we can be tracked, and there's plenty of good reasons why you might want to carry your health history around.
Let's hit on that. Probably the best argument going is just that. If you're in a medical emergency, you're incoherent, someone scans a chip, and they know really how to best treat you. Is that
especially
the best argument?
That's absolutely right. It is a great argument, and especially when our American healthcare system is under such stress. Trauma units around the United States have to spend an incredible amount of time trying to figure out what might happen if they did X versus Y. If patients who have chronic disease had chips like these in their arms, they could be scanned on admission and save tons of time, probably increase patient safety too.
Real quick, I know there's a concern that you might create a have versus have not, that if you have the chip, you're going to get better health care, and those with money are going to have the chip.
That's right. The guy who's got the chip may get through the emergency room faster than the guy who doesn't. And of course, the other piece of the resources question is, what are we going to store? I mean, I may have better health insurance than someone else and want to store information about my kid that could end up getting them into a better place or help them move through society in an easier way.
All right, let's hit on the other side, the privacy concern. That's one of the big issues. First off, who's going to have access to this? Who's going to be monitoring my every move?
Well, that's right. I mean, privacy in the world of medicine is already something of a misnomer. Your medical records are shared not only with your doctor and your hospital, but also with the drugstore, who share it with the insurance company, and your records move around a lot. I think a lot of us are worried that a rice grain sized chip in our arm makes us pretty exposed where that information is concerned. I'm not worried that when I go through the toll booth, they'll read my chip, or that McDonald's is going to know that I want a supersized meal or shouldn't have one. What I'm worried about is that that medical information could easily be hacked. And in fact, today, the New York Times published a report that said these same chips can be infected with viruses. It's very easy to hack computers these days. Are you sure you want to wear one? A lot of privacy advocates will say.
All right, Glenn, before we let you go, would you do it if you were offered today?
Absolutely. To be frank, I think it's fascinating and exciting. In the long run, we'll conquer these privacy concerns. Everybody will have one of these chips. The reason that I would do it is because it seems to me there's so much about you that doctors need to know quickly. And if they had the capacity to scan at the bedside or at the roadside after an accident, it could really, really improve the quality of care.
Last one real quick. How long before this is really prevalent?
This will be everywhere in American medicine within 5 years.
5 years, wow. All right, Glenn McGee, always good talking to you. Thanks again.
Good talking to you.
5 years, that's kind of quick. All right, beginning tomorrow, office bragging rights are on the line. It is March Madness.